Is this live?
It's loud.
All righty. Good Thursday morning to you, Facebook people. I'm City Councilor Pop Barnes, and if any of y'all know me, you know how interested I am in health, because I want each of you to live a long, healthy life with your loved ones. And I really try to get information out to you too. So what we decided to do is to do a weekly Facebook Live program, Pop Barnes Health and Community Tip, with Integrative Healthcare Partners, two organizations that have done so much in the community, have joined forces in this integrative health. And we're going to explain to you this morning what integrative health is. So now, we're not going to be coming on Thursday. We're going to be coming on Monday, every Monday morning from 10 to 10:30 with your health or community tip. And so what I'm going to do right now is to introduce or have the community partners introduce themselves. So I'm going to throw the ball now to Miss Andrea Winston. She's the CEO of New Horizons Behavior Health. And Andrea, if you could introduce yourself and Susan, and if you can just start the presentation, and where Tree of Life will come in, then Reverend Client will be able to take it from there to talk about how Tree of Life began. So Andrea?
Yes, sir.
Andrea Winston, my friend and my former boss many years ago. Andrea.
Oh, here we go. I'm so glad that you gave us this opportunity, Councilman Barnes. Again, I'm Andrea Winston. I'm the CEO of New Horizons Behavioral Health. And New Horizons has been in this community for a very long time. We were previously the area mental health, mental retardation, and substance abuse authority, but currently we serve under the name of New Horizons Behavioral Health. And we're just really glad to be here this morning. And I have been talking with Councilman Barnes about the intersection of primary care and psychiatry as being what I call the sweet spot for wellness for the general population. A lot of people suffer from mental illness, and we'll get into some of the statistics later on, but everybody needs access to good primary care. And why should you have to shop around and go to multiple places to get what you need? So now, through collaboration and partnership with our partners with the Tree of Life and Pastor Client, we are engaging and continuing our efforts in primary care and psychiatry, thus called integrated health care. And so we're going to go through a brief presentation that we have just to give you some of the details and information. And I want you everybody to listen very closely, because I'm sure that you could see either yourself or somebody that you know in the information that we're providing. And so I'm going to also introduce to you today our Director of Marketing and Information Services, Ms. Susan Gallagher.
Good morning, Ms. Winston. Thank you so much. And again,
yes, ma'am.
Pops, thank you so much for allowing us this time. And Dr. Client, thank you so much for being such an integral part of this partnership for whole person health. I am going to disappear now from the presentation and pull up the slideshow. Know that I'm behind the scenes pushing the buttons. Thank you.
Hello, I'm Pastor Client, Tree of Life Healthcare. And we, some 15 years ago, the genesis of Tree of Life Healthcare really came about when my wife came home and told me one day about a young child that his grandmother was his guardian, and had a sinus infection. And he's going to wait a couple of weeks before she gets his prescription filled. And in the meantime, that child died from a sinus infection. And that just really bothered me for weeks on end. And just riding in my car one day and just started frustrated and said, Lord, somebody has to do something. And reply came back to me in audible voice, you do it. And so that was the genesis of the Tree of Life Healthcare. And I'm so grateful for what Council Barnes is doing and working with New Horizon and this collaborative effort. But we know primary health care and mental health go hand in hand. It is extremely important that we begin to realize the importance of mental health and the importance of, again, managing chronic illness along with those diagnoses as well.
Well, I'm just thankful that you two organizations have done so much over the years for individuals who have no health insurance or are severely underinsured. And so we're going to, our Facebook family, we're going to give you a treat because now Susan's going to let you know everything about integrative health, which is New Horizons Behavioral Health and Tree of Life. Okay, Susan.
Great. Are you all able to see the shared screen?
Yes, ma'am. It's looking
Okay,
just fine.
fantastic. Just want to make sure that we aren't having any technical difficulties. So integrated healthcare, as Ms. Winston said, is that sweet spot of primary healthcare, mental health, and substance abuse treatment, all in one location, able to treat the whole healthcare needs of the individual. As human beings, we're made up of mind, body, and soul, and integrated healthcare takes that fact into deep consideration and brings forward a model of healthcare that treats mind, body, and soul through primary mental health and substance abuse care under one umbrella. Ms. Winston mentioned a little bit about New Horizons Behavioral Health. We've been serving the Chattahoochee Valley for over 40 years. We are one of the Tier 1 providers of behavioral health care in the state of Georgia. Tier 1 providers are community service boards, and currently there are 23 community service boards within the state of Georgia working under the auspices of the Department of Behavioral Health and Developmental Disabilities, serving all 159 counties in Georgia. New Horizons Community Service Board, doing business as New Horizons Behavioral Health, serves Harris, Talbot, Muskogee, Chattahoochee, Stewart, Quitman, and Randolph and Clay counties in southwest Georgia. We have over 22 programs throughout our 8-county service area. We have a staff of over 400, including psychiatrists, nurse practitioners, registered nurses, LPNs, licensed clinical social workers, licensed professional counselors, peer specialists and certified peer specialists, as well as residential specialists, behavioral health specialists, house parents. New Horizons has a fleet of its own vehicles, and then we have our administrative support staff. I fall in with administrative support staff as well as our finance, accounting, human resources, our fleet of vehicles, our IT department. So we're a very large organization serving the behavioral health needs of individuals in Southwest Georgia. We are part of the Georgia APEX program, which is a special contracted services with the Department of Behavioral Health and Developmental Disabilities. And currently we embed mental health professionals in 3 school districts, Chattahoochee, Stewart, and Quitman. And recently we began providing services to the Muskogee County School District with the Alternative School. We provide permanent supportive housing in Muskogee and Harris counties and rapid rehousing services to our rural counties through HUD funding. A lot of individuals experiencing homelessness have an underlying mental health or substance use condition, and we provide not only housing, but that case management that works with the individual to develop those life skills necessary to live with a chronic disease. Our community support services houses over 150 individuals in 50+ housing units. And this is something I don't think people realize is the depth, breadth, and scope of what we do at New Horizons. We're not just that outpatient mental health clinic you see. We provide housing services to individuals. We do homeless outreach. We're in the accountability courts. We're in the jails, meeting the mental health needs of individuals wherever they are. We are the area leader in behavioral health care services to justice-involved individuals, and we provide re-entry services to individuals who have been released from state hospitals and crisis stabilization. At New Horizons, yes, sir.
Could you speak a little bit more when you talked about the courts? That's something that a lot of people don't realize as well. How you support the court systems, like the
Right.
sexual abuse court, veterans court, and whatever.
Sure. Back in 1992, New Horizons partnered with the Muskogee County School District and the Juvenile Drug Court to bring the first accountability court to Muskogee County through the Juvenile Drug Court program. And since then, New Horizons has been instrumental in expanding the scope and focus of accountability courts in Georgia. A lot of times individuals—
what accountability courts are as far as abuse and whatever.
An accountability court is an opportunity for an individual to participate in a treatment program, whether it's for a mental illness or a substance use disorder or a co-occurring disorder. The individual will be mandated to this program as opposed to serving jail time. They will have weekly meetings with the judge and the drug court team. And the team is comprised of individuals from the courts, individuals from the treatment providers, case managers from the courts, individuals from the district attorney's office. So it's a way, I like to say, a carrot and a stick. The carrot of having your charges eventually expunged if you're a first-time offender is what we wave in front of them to get them to adhere to the treatment plan that's set up for them. A lot of times people need to be persuaded to receive mental health or substance use services, and accountability courts are a way to persuade people to get the treatment that they need. New Horizons is involved with the adult mental health court, the adult drug court, and our most recent court that we've expanded and partnered with is the family treatment drug court, which is a civil court where most of the referrals come through DFACS. Okay. So we're very instrumentally involved with that. A lot of times people with mental illness or a substance use disorder find themselves involved with the justice system. And what they may not need is criminal punishment. What they may need is behavioral health treatment. And accountability courts put some accountability on them to continue with their treatment. And what I was going to say is at New Horizons, our motto is building better lives, but it's more than a motto, it's our mission.
That's awesome.
Back in 2019, in FY 2019, we served over 8,412 individuals throughout our 8-county service area, with 1,036,282 encounters, meaning in contact with those 8,412 individuals. So you can see we're a large organization and we provide a large gamut of services. We are the Tier 1 Community Service Board Behavioral Health safety net for those 8 counties in West Central Georgia. We are a fee-for-service organization. We bill Medicaid, Medicare. We do have state grant and aid funds, and we bill private insurance. But one of the things about New Horizons is we serve individuals regardless of their ability to pay. In FY 2019, we served 910 individuals who had no way to pay for the services that they received.
And I'd like to also add that, let me tell you, New Horizons and Tree of Life, it's not about that. They're thinking specifically about the good of the patient. And so, yes, you can see from the figures here, it's awesome. And not only that, there are catchment areas in the various counties as well. And Reverend Clyde, would you just now speak to what service areas you cover?
We cover the same areas here in Georgia, but we also cover the areas in Alabama as well, as well as Lee and Russell, Finney City, and down in Fort Mitchell. And so we say to people, if you can get to us, we're going to serve you. And we believe as well is that it's extremely important that people's health and their ability to receive quality health care is extremely important. One of the things we do also with Tree of Life is I think is extremely important because when you look at a patients and their ability to pay, it goes beyond that, they have the ability to get their prescription filled. So we have an in-house pharmacy. And if we don't have it in-house, we get them on a discounted program or an patient assist program to help them with their medication. At that time, between 6 months to a year when the pharmaceutical will provide their medication at no cost.
Right. That's why, look, that's why I tell the Facebook family here why I support organizations like you two. We're at about almost 15 minutes. So next slide, Susan.
Next slide. Next slide is a little bit more about the Tree of Life. If you want to speak on your mission at the Tree of Life, Pastor Clyde.
And we say our mission is to be a demonstration of the love of Jesus Christ and providing quality health care. We tell people all the time, of course, our mission is medical, but our purpose is to be just that, to be a living demonstration of who God is and to be a reflection of that. We serve people here that with primary health care, and also we have an in-house eye lab as well. We work with individuals along with the Georgia Lionhouse of Georgia as far as sent about eye patients. So we serve people that have no health insurance or they're underserved. And again, it doesn't matter. Sometimes people have the ability to pay, sometimes they don't. But we're here for them because the health is extremely important, especially this time of COVID-19.
And that was one thing that joined us together as organizations. We both know the importance of serving the uninsured and the underserved in our communities. Individuals with mental illness, living with a chronic mental illness, a long-term mental illness, have higher rates of physical illness than the general population, more likely to have high blood pressure, heart disease, diabetes, obesity, and the illnesses that obesity brings along, asthma. If you're living with a chronic mental illness, you're also more than likely to have one of these chronic health conditions also. There are social determinants of health, and Ms. Winston, would you care to?
Yes, ma'am. I know that's a fancy word, but it just means that there are things that are going on in our lives or our lifestyle or where we live or how we live that determine or impact our ability to achieve health and wellness. So, and we look in looking at the social determinants of health, one of the things that we're seeing in Muskogee County is that 49% of our children are living in single parent households, and that 13% of our people don't have any insurance, and that 11% of households do not have a vehicle available for transportation, and that 13% have less than a high school education. And some of the other statistics are that 21% of our people here are living in poverty, and that includes 30% of all children, which is very upsetting, and that we have a little bit over 6% of unemployment rate, and that 21% people report food insecurity. That means at the end of the day that they're not feeling like they have enough food to eat. And all of these statistics are very unsettling as regards to Muskogee County, because Muskogee County is ranking 101 out of 159 counties in Georgia for the ways that we're looking for our overall health. So we've got some struggles in Muskogee County, and that's one of the main reasons that we're really focusing on integrated health, because we can help address all of these things. Some of these things that we struggle with that I just mentioned in the data and how it relates to our overall health.
And Andrea, thank you for stressing that and getting this together, because those social determinants really exacerbate or make worse the conditions that the individuals have.
They really do, Pops. And on the next slide, we're talking about all of this information, but then people may wonder, well, why should I care about this? Why is this such an important issue? Well, the reason that general population and our leaders and policymakers should care about this is that having a mental illness makes life challenging not only for that particular individual, but it also has a ripple effect in that it makes issues difficult for the families and the communities. Like we keep saying, that people with serious mental illness have an increased risk for chronic disease, and that the family oftentimes will spend very limited resource trying to provide for and care for adults and children with mental illness. We get calls all the time from family members asking, what can I do? How can I help my family member or my loved one that's struggling with a mental illness? And we see how this kind of spills over into the community. If you look at our emergency rooms are overflowing with people that suffer from mental illness. 1 in 8 of all emergency room visits are related somehow to a mental illness.
Mm-hmm.
So, and then we also want to look at the other effects of our community, that 20% of people that are experiencing homelessness have serious mental illness. 37% of people that are incarcerated in our jails and federal prisons have a diagnosis of a mental health issue. Then 70% of youth in the juvenile justice system, such as juvenile court or even going on to our YDC, they have mental health conditions also. So pushing this issue is very near and dear to me, because we want to look at individuals with a mental illness have a life expectancy 20 years less than the general population. And let me just say that one more time. If you have a serious or chronic mental illness, you're likely to die 20 years earlier than people that do not. And that's horrible. So there are things that we can do to address that, and we'll continue to talk more about that.
And Andrea, one area here we're just going to touch on quickly because we're already at 22 minutes. We want to be timely.
Yes, sir.
I'd like to come back with one of our programs to discuss that 37% of people incarcerated in state and federal prison have a diagnosed mental condition. And pursuant to our conversation, that the jails now are becoming like the long-term care mental facilities now, and that's horrendous. And so if we could put on our calendar, because you educated me and you gave me a lot of information, and it could be a show in and of itself.
Sure.
And so this is something that we need to alert the public on and get some community support, state support, so the individuals who are incarcerated in our jails need to be getting better care than in the jails and isolated. And thank you again for the conversation that we had the other evening. Next slide, please.
So
this is huge between New Horizons Behavioral Health and Pastor Clyde, Tree of Life. And you were going to make a comment, sir.
Yes, I think it's extremely important now. I mentioned COVID-19 earlier, and the effects of having on the Black and brown communities as far as our high rate of death. And we know that the three leading diseases, chronic diseases in the Black communities are heart disease, hypertension, and diabetes. We put a tremendous amount of stress on the cardiovascular system. And so we're asking, I want to see if you come in contact with the virus, then it's going to put additional stress on the cardiovascular system. And that's some of the contributing factors why we're dying at a higher rate. So I think it's extremely important that you prevail yourselves to a place like New Horizon and Tree of Life, so you can know your numbers. And if you do have one of those issues, that we can get you on a proper medication. So if you do come in contact with the virus, you have a better chance of living.
Sure. Now we've got about 7 minutes left in the program. We want to be timely with our Facebook audience. Let's talk a little bit about, could you go back, Susan, to the other slide, please, to the goal. The goal of Integrated Health Partnership. I will open it up to Andrea and to Reverend Clyde.
Sure. As we look at the numbers, I just want to stress that mental illness is a public health emergency. And especially with the advent of the pandemic, it has been pushed to the forefront, because if you think about it, There have been a lot of people in Muskogee County and the counties that we serve that have become COVID positive, but there have been way more people that have suffered as a result of the pandemic, causing emotional distress. 1 in 5 people will have some sort of mental illness, whether it be something on the milder spectrum of depression or something more severe, or higher on the spectrum, such as schizophrenia. But 1 in 5 people, so if you're in a room, Facebook family with 5 people, there's one person in there that's most likely suffering from some sort of mental illness.
Exactly.
And that means that when you're suffering from mental illness, that you're not able to attend to your health care needs the way that you should. So that's the goal of the partnership, is to be able to bring those two things together and to ensure that people that are struggling with mental illness receive primary care, and that they need basic things such as somebody to check blood pressure. We need to be checking blood sugars. We need to ensure that men are getting prostate exams. We need to ensure that women are getting mammograms and pap smears each year. Basic things that a lot of us take for granted, that our primary care doctor just orders and we go get. If you're having a mental illness, it's not as simple as that to do that. So the goal, that's the goal here, is to help increase the life expectancy for people with a mental illness. And we're talking about a lot of people. So we're really pleased to have advocates in the community. Our mayor is a great advocate for this concept and for integrated health care, as well as several of our council members and various community leaders. Our hospitals are very supportive of this, and we want to continue to get the word out. So one, that you can know about the resources that are available for your family members in your time of need. And you will, I'm sure most of us know somebody that could benefit from these services right now.
Yes. Reverend Clyde?
We are finding right now, especially in our climate today, with the things we're dealing with, patients that we have in our clinic that have a chronic diagnosis, they're under stress, there is anxiety, they're depressed, some are angry about it. And so all of those things, you have to begin to understand that mental health is extremely important. There's a stigma to it that shouldn't be there, but we have to educate ourselves as to the importance of mental health and physical health, how they work together.
And Susan, can we go quickly through the others? We've got exactly about 3 minutes.
Okay, well, I will go quickly through the others. So Tree of Life Healthcare served over 1,118 patients with primary health care in FY19. And the main issues they deal with are hypertension management and diabetes management, which are also illnesses that affect individuals living with chronic, severe, persistent mental illness. New Horizons serve.
Susan, can we go to slide 12?
Slide 12, the last slide. So what can individuals do? You can advocate for the work that we do, New Horizons and Tree of Life, encourage local community and city governments and community leaders to include New Horizons Behavioral Health and Tree of Life Healthcare as part of any community-wide health initiative.
Exactly.
Integrated health needs to be included in any community-wide health initiative.
And I just want to thank both of you organizations for being with me weekly. I'd like for everybody to know now, we're not going to be on Thursdays. We're going to be every Monday morning from 10 to 10:30 with your tip, your health or community tip. A tip for your health so that you can live a long, healthy life with your loved ones and productive one. And just community information, good information to help you on your way of life. And we just want to thank you all again. Thank you, Andrea.
Yes, sir.
Thank you. Andrea Winston, she's the Chief Executive Officer of New Horizons Behavioral Health, and Reverend Dr. Laurel Clyde of Tree of Life, and Miss Susan Gallagher. Thank you all so much. And until next Monday now, Monday at 10 a.m., please be good and kind to yourself. Because you know why? Because God loves you. God bless you now. Bye-bye.